Hey, my name is Drew. I'm going to be your student nurse today. The doctor has ordered for us to put in a Foley Catheter. And what that is, it's just a tube that runs up your urethra into your bladder, and it empties your bladder for you. And we're also able to closely monitor your urine output while you're here in the hospital. So can I have you state your name and date of birth for me? Okay, Mr. Smith, I've confirmed the order. We're ready to get started. I'm going to push you in the supine position, and I'm going to lift the bed to a comfortable working height. And while I'm doing that, do you have any allergies to latex, betadine, or iodine that I need to know about? Okay, that sounds good. Now I'm going to draw your covers back, if that's okay with you. And I'm going to lift your gown up to provide perineal care. I'm going to set this towel down here below you. That's to prevent your sheets from getting dirty or wet while we're doing perineal care. I'm going to just wash the penis, making sure to use different sides of the rag. And then I would get a separate rag and blot it dry. Done with that, set that over there, take my gloves off, and I will now re-sanitize my hands. And we're about to get started with the procedure. So I'm going to remove the sterile Foley Catheter kit from the plastic bag, and I'm going to make this into a trash bag. And I'm going to touch the outsides, fold away from me, because this is sterile. Now I'll put on my sterile gloves. Now that my sterile gloves are on, I can readjust them. I'm going to be conscious to keep these above my waist and not touch anything outside of the sterile field. So now I'm going to get this drape. This is just going to extend the sterile field. I'm going to place it shiny side down. Take this out, and I will now squirt out the lubricant. That's just going to help the tube slide in better. Throw it away. I'll get the iodine solution, squirt it on the cotton balls, throw that away. And now I'm going to test the balloon in the catheter tube to make sure it is working properly. So I'm going to insert all 10 cc's of sterile fluid into the balloon. There doesn't appear to be any leaking or any type of malfunctions. In real life, I would wait 30 seconds to ensure that the balloon is working properly, but I'm not going to do that today. Now, I'm going to take the packaging off, throw that away, and I'm going to let the end of the tube soak in the lubricant. I'm going to break sterile field with my left hand now by grasping the penis, and I'm going to start cleaning using circular motions. Throw it away. And throw it away. So now I'm going to also throw away the tweezers. So now that the tube is nice and lubricated, we're about to start the insertion. I'm going to have you take a few deep breaths, Mr. Smith, and I want you to let me know if you feel any excruciating pain. So we're getting started. Keep taking those deep breaths. Keep taking them. Keep on. And I'm beginning to see some urine in the tube, and we're gonna go a little bit further until we get to the junction. I'm gonna hold that in place with my non-dominant hand, and I'm going to inflate the balloon with all 10 cc's of fluid. So now that the balloon is inflated, I will pull on the tubing until I meet resistance. That's just to ensure the tube is in the bladder. So now that I have met resistance, I will tape this to the upper thigh. Now that is taped to the upper thigh, I'll hang the bag on the frame of the bed, making sure to keep it below his urinary bladder. And I will now obtain a sample of urine from the freshly hung bag. Now, if this bag would have been hung for a few days, we would not be able to get the sample from the bag. We would have to wipe the port with an alcohol wipe and obtain it through there. So we have obtained the sample. Now, in real life, I would not pick this up off the floor and put it on there, but since we're not in real life, I'll just do it that way. So now I'm just going to clean the area up, but first I'm going to clean the betadine off of the penis. Now that that's done, dispose of that, and I'll continue packaging and cleaning up the area. Alright. Cover him back up, pull his gown down, cover you back up real good. Now I'm going to remove my gloves and put the bed into the lowest position. Now, Mr. Smith, are you feeling any extreme discomfort? Okay. And I'm also going to lift the head of the bed and make him a little more comfortable. I'll be back to check on you in a little bit, Mr. Smith. Hey, my name is Drew. I'm going to be your student nurse today. The doctor has ordered for us to remove your Foley catheter. It's a very simple procedure. All I'm going to be doing is deflating the balloon and just pulling the tube out. And then after that, I'm going to provide perineal care, clean the area. Before we get started, can I have you state your name and date of birth for me? Okay, Mr. Smith, I have confirmed the order. We're ready to get started. I'm going to put you into the supine position. And I'm also going to lift the bed to a more comfortable working height. So I'm going to uncover you if that's okay with you. And I'm going to lift your gown up. So the urine bag has been emptied. We did that first step. And I'm just going to now untape it from your leg. And I will draw back the 10 cc's of sterile fluid that is in the balloon. So now that all 10 cc's have made it into the syringe, I'm going to have you take some deep breaths and I'm going to begin pulling the tube out. Get the bag. And I'm going to wrap it in this and dispose. Now I'm just going to provide some perineal care and clean the area up. I'm going to lay this towel down to prevent your sheets once again from getting wet. I'm going to clean using different sides of the rag. And then I'm going to blot it dry. I will wrap this up, dispose of it. And Mr. Smith, I'm going to pull your gown back down and cover you back up. Now, are you feeling okay? Is there any discomfort or anything I can do for you? I'm just lowering the bed to the lowest position, and I'm lifting the head of the bed to just make him a little more comfortable. I'm gonna remove my gloves. Alright, Mr. Smith.